Dr Chris Blyth, you're a paediatrician?
I am.
You work at the Children's Hospital here in WA in Perth?
I do.
Okay, I'm here to ask you a few questions and have a discussion with you about COVID.
Great.
And fortunately for me at this time, I'm here in Western Australia with you, and this is one of the only states that I feel safe in. I've lived over east for the last few years, and out other side of Melbourne, so I didn't really get to be restricted a lot by the COVID, and living in regional places is a little bit more open, as they say, but the cities of Melbourne and Sydney and other big towns on the east coast are now suffering from the misadventure of others in relation to COVID and their response. But a lot of us Aboriginal people, us blackfellas, we call ourselves someone, or the mob, we have talked about COVID, and we've talked to older people about other pandemics that have occurred in Australia. We talk about the flu jab. We talk about other medicines that we've taken and why should we be doing this. A lot of misinformation about how we react to particular viruses like the COVID is always there. There's always some sort of misinformation, and it might not necessarily come from us Aboriginal people, but when the discussions happen with our people, it's very alarming to people like me because there's a lot of indecision. So let me start by just asking you to introduce yourself in a sense of working with kids then, because kids, in fact, are one of the groups of people that are going to be held off until last to get the COVID injections, because we believe that older people are more vulnerable. Is that true?
That is true. So yes, I'm a paediatrician, that's my day job, but I spend a lot of my time working on vaccines and trying to work out how best to give COVID vaccines and other vaccines to not only Aboriginal people but to all Australians. So I'm spending a lot of time in that. And you're right, children are at lower risk of COVID compared to older Australians. So that's why, at least with the start of the vaccine program, we started with older Australians. But importantly, it's now everyone's turn, everyone over the age of 12, to get a COVID vaccine, because you're right, we're feeling safe in Western Australia at the moment because there's not a lot of COVID, but I'm a bit pessimistic. It will come, and so it means that people will be exposed and will be at risk.
Good, yeah. I've got to agree with you. I feel the same way, that it's good to feel safe here at the moment, but the reality is that the vaccinations have been talked around Australia now, and they've been talked about, and there has been a rise in the number of people that are wanting to be vaccinated.
Yeah.
I think that's a result of the visual impact of knowing that others are dying, and there are people, not necessarily older people, but middle-aged people that are also caught up in death and dying as a result of their health and what's happening around them. So some of them haven't necessarily got the COVID when they die, because they die of other things, but when they're given the COVID and there's a death, it's recorded as a COVID death.
That's right.
Why is that so?
Well, COVID, unfortunately, is a new illness that can kill people, and so that is clearly what we're trying to avoid with the program. Importantly, COVID is a new virus that spread from person to person, spreads within households and spreads within communities. Spreads through the air so you can't see it, and unfortunately that means that people get affected. And some people are at greater risk of the problems with the lungs that occur with COVID, and older people and Aboriginal people are at greater risk, and that's why we're very keen to make sure that everyone is protected against this. We can only look to overseas and see the incredible impact, the catastrophic impact this has had in other countries. And also looking at New South Wales and Victoria at the moment, the real toll that's happening in those big cities, but also some of those regional areas that are really being hit hard at the moment. And I'm going to do as much as I can to try and prevent that here.
Good, yeah. I noticed that some of the Aboriginal populations in some of the bigger towns over on the east coast are now more vulnerable than they ever were. So, yep, it's very scary. But it's interesting. You said, you know, it's contracted by airborne virus and touching, and so it's a lot different than the normal viruses that we humans come into contact with. The Delta strain in particular is a very severe strain, so we all accept that there's a strain. And is it likely that there could be other strains that come into vogue in the future, or are they going to be more deadly than Delta, or what do you think about that?
The first answer to the first question is yes. This is a virus that is continuing to evolve. That's what viruses do. Yeah. Will new viruses be more transmissible, in other words, spreading from one person to another person, than Delta? I don't know at this stage, but new viruses will continue to evolve. Right. And new viruses evolve when there's spreading virus. So whatever we can do to try and stop the spread of this virus will decrease the chance of new viruses coming.
Well, I want to say to you that there's another colleague that I bumped into called Dr Norman Swan. And Norman Swan was one of the first protagonists to alert Australians about the airborne particles in the air over on the east coast where I was. And so we do have to look up to you non-Aboriginal experts to say and do things that are clearly advisable for us and others in Australia. So I just want to personally thank people like yourself and others who stand up and say this is what it's all about. I want to go through the list in a sense, but try and promote a discussion with you at the same time. Right. So, can you get the COVID from having the vaccine? Some people that I've talked to, in fact, have said this. I always get the flu whenever I have the flu vaccine. Is there a similar construct, or is that not necessarily true? You might have a reaction to the flu vaccine, but what's that about?
You can't get COVID from the COVID vaccine.
All right.
What the COVID vaccine is doing is tricking your immune system to thinking that it's had COVID before. So it's taking a piece of the COVID, like the flu vaccine does, yeah, taking a piece of the COVID and letting your immune system respond to that, tricking you that it's seen it before. And the reason that's important is next time it sees it for proper, it can mount a quick response as opposed to having to wait. And that's what vaccines do. All our vaccines do it in that way. But you know what? Some people do feel crook after a vaccine because that's their immune system responding to that piece of the virus. But importantly, you can't get COVID from the vaccine.
All right. So people, don't be tricked.
Don't be tricked.
Don't be tricked by anybody telling you that you can.
Yep.
And just take it for gospel, okay, that you might have a reaction to it, which might be more severe than you think, but it ain't going to be COVID that you're catching. It's a reaction to the actually serum that goes into your body from COVID, and like you said, it's the COVID virus trying to trick you into believing that you're sick.
Well, it's the vaccine that's trying to trick you that so that your immune system can respond.
That's right. All right. There are some people, and I too know this, there are Aboriginal people that I've talked to have said, no, we Aboriginal people are different. This is a white man's virus, or it's a virus for other human beings. Mm-hmm. We're not going to get it. What if I told you that there are people out there, I think there are probably non-Aboriginal people who think too they've got the best immune systems and they're AFL footballers or they're fittest footballers and the netballers, but it's a fallacy, isn't it?
It's a fallacy. And you're right, Aboriginal people are different, we're all different, but importantly we're all susceptible to this virus. We're not immune. Aboriginal people in Western Australia have done a really good job at protecting themselves for the last 18 months by doing all those really simple things, making sure that they know who they're mixing with, making sure that communities are shut down or are not mixing. That's been really good. Yeah. But the problem being is we can't do that for the next 50 years.
No, we can't.
So Aboriginal people are at risk of COVID, and we know those who've got particularly underlying heart, kidney, diabetes, are at increased risk of COVID, and Aboriginal people have higher rates of that. So I suppose I'm really worried for Aboriginal people in Western Australia at the moment because they are at risk, and a vaccine is really important.
Yeah. I have lifestyle diabetes. I've had my two shots, so
Fantastic.
I feel a little bit more secure about that because I intend to travel back over to Victoria and take on some part-time work over there. But I've got my family living back over here, and I need to come back and be safe when I'm coming backwards and forwards.
I'm so glad you've had your 2 doses because I've had my 2 doses as well, and I suppose what it gives me is it gives me the sense that I'm protected, but also it gives me a sense that I'm protecting those people around it.
Oh yeah.
Protecting my parents who are old, protecting my kids, one of them who's too young to be vaccinated.
Yeah.
I can't do something about that, but I can vaccinate myself to protect them and my community.
I won't tell you the numbers, but I have great-grandchildren from 8 children, and I won't tell you how many grandchildren I've got, but there are a lot of in my family. So yes, we need to be sure that we're not passing it on.
That's right.
Yep. That's good. I've sort of asked you this one, but again, can the vaccine kill me?
The vaccine is there to try and protect you against COVID. And we know that COVID is killing people at the moment. I'm going to jump to your next question though. Can you get side effects from the vaccine? Yeah, you can.
Of course you can, yeah.
And there's common side effects and there's uncommon side effects. And a very, 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 very small proportion of people can have a bad side effect from the vaccine, and a small number of those can die. Yeah. But in perspective, compared to the hundreds of thousands of people who are likely to die from COVID compared to that one from a vaccine, that's very different. Yeah. What do you expect when you get a vaccine? Well, actually, those things you get with your normal vaccines is what I expect with a COVID vaccine. Most people get a sore arm. Yeah. About 1 in 5 will get some fevers or shivers or shakes. Actually, a lot of people feel really tired for a day or two, and some people will get some muscle aches and pains or a mild headache. Actually, that's pretty common with both vaccines we're offering at the moment. There are some really uncommon side effects, and I can talk about those for your listeners as well. But to answer your question, realistically, the benefits of vaccinating are vastly greater than the risks.
Good. Yeah, it's a discussion I could continue to have with you. The nervous nature of populations like Indigenous Australians and the mistrust we have in the mainstream and white professionals to deliver proper health care for us is still quite obvious in many of our people. So it may take a little bit of a while for that stuff to come through, because when the AstraZeneca was offered to all of us over 60, and I'm over 60, we had heard about some blood clotting, and a lot of us turned off AstraZeneca. So when we became aware that we could have the Pfizer, we started to come forward, because there was this percentage that people discuss, 1 in a million, or what is it, 2 in a million chance of happening. And when you think that 1 or 2 people in a million are going to die because they've gone and had the vaccine, people will shy away from that because they don't want to be the 1 or 2. But the message is, it's better 1 or 2 on the way through, regardless of who they are. I'm sorry to say it like this. We know that this is about the population in a whole. The whole population needs to be looked after, and we need those people to be strong enough to not believe that you're going to be 1 of the 2 out of the 2 million or whatever. And hopefully medicine and health systems can develop the knowledge as to how to even diminish that further. But I say today, go and get vaccinated, because it's not about you, it's about everyone else who lives in Australia, but particularly your family. Yeah.
And I can understand some of that hesitancy. I can understand some of that mistrust. I suppose what my approach is, I'm keen to give the facts. This is what we know, this is what we don't know at this stage, this is the benefits, this is the risks at this stage. Now, some of those rare side effects are a real worry, particularly if there's no disease. But when you start having disease and you start having infections coming through the community, I can absolutely reassure your people, your family, that actually the risks of the disease are far greater than the risks of the vaccines.
Good. I get it. Can the piece of vaccine alter your DNA? Can any of the vaccines alter your DNA?
No. So the reason this comes up as a question is one of the vaccines, the Pfizer vaccines and the Moderna vaccines, use some of that blueprint that is similar to your DNA. And they use that as a message to give your body to start tweaking the immune system, like I said before. It's a message. It doesn't get incorporated in DNA. It's a message that lasts a day or two in your arm, but that day or two is enough, importantly, to give the message to your immune system to then make that immune response. Doesn't get into your DNA, doesn't change your blueprint, doesn't change you.
So while we're talking about the vaccine then and the vaccinations, I've had my two. What's the difference between having one and two, and possibly even another follow-up in about 6 months? What's that for?
So when we try and develop a good immune response, we usually need to give a little bit and then remind the immune system. Remind it so it can make a long-term immune response. Lay down that immune memory. And for many vaccines we use, we need a number of different doses. Many vaccines that we give our kids, that we give our elderly, we give one dose followed by a second dose. It's exactly the same.
Name some of those.
Some of those. So vaccines such as flu, you get a dose every year. Aboriginal people, pneumococcal vaccines, we give our Aboriginal elders as well as our Aboriginal children. Meningococcal vaccines, other important ones for Aboriginal people. Give our young kiddies whooping cough or pertussis vaccines, and our Aboriginal mums, influenzas and whooping cough vaccines during pregnancy. So we use these frequently throughout life, often giving that one dose followed by a couple of other doses as well. We do know for COVID vaccines that actually 2 doses is really important to get the levels of immunity that we want to protect. You get something from one, but you don't get enough to protect you as well as we can. And so 2 doses is really important, and both vaccines we're using, and the third one that's coming in the next couple of weeks will be 2 doses, sometimes separated by different time periods, so you need to check with your nurse or the doctor who's looking after you about what the interval is, but 2 doses.
There you go.
Can I preempt your next question?
You can.
Will we need a third dose?
Yep.
Do you know what? I reckon we will need a third dose.
All right.
We're seeing that 2 doses is working really well, but it is likely that that will decrease over time. And so for particular groups who are at greatest risk might need a third dose, such as those who have immune problems or the elderly, but it's not over the next couple of months. That's down the track.
That's down the track. Yep, I remember as a kid having lots of more needles than I thought I wanted, but Mum made me have them. So this is probably another comment that I've heard. No, I'm going to wait and see what happens. And so I think what's happening now is that the people who said this to me a year or 2 ago have been waiting, and they're seeing what's happening. And the lockdowns, and there are certain numbers that we always see that once the lockdowns are in place and it gets broken because someone's gone into these places and spread, called super spreader events or a spreading event. It's something that people want to know. Well, is the vaccine really safe for me? There are a lot of medical conditions, lots of medications. How do I know the vaccine is safe for me? I think you've answered that, but I just wanted to extol the virtue of trust, to say, yep, we're all here to assist other human beings who aren't working close to the coalface to know what's right and what's wrong. And it's right that we should get the vaccines and go through the process and understand that this is for all of us, not for individuals. So it's important that if you are an individual and you have concerns as to not wanting to do the vaccine, perhaps I could encourage you to come and talk to doctors like Dr Chris. And maybe the next question is then, well, how do people get to talk to people like you, like I am? Because this is great. I got a person like you in front of me and I can drill you about it.
Sure.
But others, I've been hesitant to go and do the AstraZeneca. I tell you, I wasn't going to go and get it. But I talked to others and said, no, we've got to do it. So are there others like yourself that are out and about doing these messages and getting them out there? What happens when we walk into a doctor's clinic? Are they able to sit down and do what you're doing with us?
Yes.
Yeah.
So there is lots of people out there, many people who want to talk about vaccines, and there's people close to your friends, your family, who want to do that. Yep. Whether that be at their local general practice, at places like Derbarl, Yerrigan, at their local AMS, even their local child health nurse and sisters and things like that. There are people who want to talk about this, and importantly to extol the virtues of vaccines. Yep. I can understand why people wanted to wait a number of months ago. If I could implore them now's not a time to wait. Yep. And the reason why I'm saying now's not a time to wait is back then we didn't know whether we could eradicate COVID from the world. It's not going away.
No, it's not going away.
If it was going away, it would have gone away by now. It's continuing to change its colours and continuing to evolve and will continue to spread. So people are at risk. Yeah. So it's not time to wait at this stage. Yeah. We also know a lot of information about the vaccines we're using. We know what to expect, the common, the unexpected, and importantly, we have given these vaccines to billions of people around the world. In fact, in Australia, I think we're about to crack 20 million in the next couple of days. Yeah. So huge amounts of people have had these vaccines, and importantly, we know what we're dealing with, we know how they're working, and we know the benefits they're going to give you.
Yeah. And once the economies start to shape up again, we Aboriginal... Hold on, a cup of tea. We Aboriginal people want to be a part of the system that we call Australia, and therefore we'll be looking for jobs, we'll be looking to mingle with other human beings. And as the economy opens up, there will be people from other parts of the world coming into Australia. So, we're a long way away from even thinking about, the eradication of vaccine on this planet, of COVID on this planet, sorry.
And even if we put all the international travel to the side, we want to be able to move around this wonderful country that we call Australia. We want to be able to visit people in different regions. We want to go to some of the far-flung places. We want to go to the busy cities. Yes. And we're going to need vaccines to do that.
We want to travel. There's a beautiful land here to drive around on and look at. Okay, so the next question I think you've already answered. Aboriginal people don't catch COVID. We've clearly identified that we will.
You will.
And we're currently at a crunch time where we're seeing it get into our communities, and so there's no worries about that. We know that we are going to be able to catch it. We want to be prepared. We want to be vaccinated. Some people in our world have challenged what we call the mainstream medical practices as to why they need to go to mainstream medical practices when we have our own healers. And so I use bush medicine is one of the questions. And is bush medicine safe to take in regards to preventing COVID?
Some bush medicine is absolutely safe to take. But importantly, I wouldn't do that and ignore other things. I think some of the stories that have come out of Sydney, the people waiting at home with COVID, using different therapies, really worry me. And so I suppose my recommendation is, yeah, it's okay to use traditional medicines, but importantly, use your people around you as well who are there to look after your health. If you're crook with COVID, don't stay at home and try and fix it yourself, because people are there to try and help you at this stage. We do have some medicines, but importantly, all those other things that people in the doctor's surgery and the hospitals can help you with. COVID affects your lungs, and people who get severe COVID get more and more breathless. There's treatments for that.
Good.
There's treatments for that to support your breathing, to help the amount of oxygen that's in your blood. Absolutely. Some of those remedies are okay, but don't do it at the avoidance of other things.
Good. So the message is clear then, that keep using the bush medicine for the reasons that you're taking it, but it needs to be clear that it's probably not going to stop COVID, but it'll keep you healthy, but complement bush medicine with the vaccines for COVID.
Yeah, absolutely. There are fantastic things that Aboriginal people do to look after their health, but importantly, do it in collaboration with your community and the people who provide healthcare for you.
So I take bush medicine when I get a chance to, and yes, I make teas out of the certain plants. I eat a lot of the natural plants, and yep, I know of some of the people that make bush medicine, and yeah, we acquire some of that every now and then. Yeah. All right, so we're getting towards the end here. I've already asked you about waiting, and should I wait until more of our mob get the vaccine? No, I don't think that's the case. If you've got access to a vaccine, yeah, get it as quick as you can. That's my message. What's your message? The
same, and importantly, if you can't get access for whatever reason, ask around. Ask people, because yeah, there are some barriers in the system. Lots of people are struggling to get vaccine, but there are vaccines. So ask around. If you get a no, not yet, go and talk to somebody. Talk to other people in your community, talk to your healthcare provider, talk to your local hospital, because we need to get everyone vaccinated. All right.
Where can we get some more information about this topic if need be?
Okay, number of different resources around. One, things like we're doing today, there's lots of opportunities for people to hear those sort of things. There are written materials available at your healthcare provider. Some of those things are being produced in language as well. So not only for Aboriginal people, for people of all languages, there's an attempt to try and put as much of that in language as possible. But also talk to people in your community that you trust. Talk to the people who are informed, talk to people who know the system, and ask them the questions, because we're all in this together. Importantly, there are people out there to help you.
Kaya Nunga, vaccine Murich. I just said to the Nungas in their language, the vaccine is good. Yeah, so I'm just saying to the Noongar people and other Aboriginal people, the vaccine is good for us. Right. That's probably all I wanted to talk to you about today, and thank you for also complementing it with a list of questions that I could ask you. So just to wind up then, you might, if there's anything that I've missed that might be said, I know that at the moment it appears that Aboriginal Australians are way behind in relation to vaccine numbers within populations, and we have a couple of models that we've introduced into mainstream health, and that is that we want to close the gap, whatever that means. It means we want to close the gap on the quality of life of non-Aboriginal people mainly, but white Australians. That's the way it started, but there are a lot of other brown-skinned people, and they come in all colours and shades now into Australia. But yeah, so I don't know where I was leading there, but what are the systems going to do to fix it up? How do Aboriginal people react to the fact that the numbers aren't right there? What is it, because there's a lack of vaccines in this country? or is it because there's a lack of proper respect for really hard up Australians, and therefore, or is it because there are some very wealthy people who can afford to get the vaccines before those who really need to get it? I don't know what the answer to that one is. I mean,
well, there's a couple of things in there, Ted. Vaccines are free. A COVID vaccine is free, but we absolutely need to make sure that we're getting the right information to the right people, and we need to make sure that Aboriginal people and other people can access that information and can access a vaccine. You're right, the proportion of Aboriginal people vaccinated is lower than non-Aboriginal people, but you know what? You can catch up. Importantly,
how do we catch up?
How do we catch up? We catch up by doing things like we're doing here, making sure that Aboriginal people have the right information, making sure that Aboriginal people can access the information, making sure Aboriginal people know that it's recommended to them, and having the conversation, making sure the systems are there so they can access it, and most importantly, meaning that they can access to it close to home and close to where they live.
Well, your challenge is to go to colleagues in the health systems and bring that about, because we Aboriginal people are only 3% of the population. Some parts of our population, the younger population's probably up to about 6%, but we have warriors, we have those that'll walk the talk to go into places and say, we need these systems to be upgraded, we need these systems to be working properly, and they need to be accessing our people. And the numbers are clear to me. They say that something's wrong in the systems, or there's something wrong in the government, and we hear that the vaccines that are coming into Australia are coming in drips and drabs, and yep, they're free, but are they accessible? Are they accessible?
If you'd asked me that question 2 months ago, I would have said, actually, you know what, there's not a lot of supply. But actually, at the moment, supply is really ramping up. And importantly, people can access vaccine, and we need to make sure that they can access it easily. And that easily is the challenge we've got, and it's one that I'm glad you're advocating for, and others need to continue to advocate for, so that we can make sure that every Aboriginal person can get vaccinated.
Doctor, I want to thank you for the discussion.
Thank you, Ted. My pleasure.
Good on you.